The topic is the STD Coalition, and we're talking to the director of the coalition, Ms. Whitlow. And of course, Ms. Whitlow, before we had our first commercial break, we promised that we'd give you an opportunity to continue to talk about the various STDs, I guess we could say, that we've not mentioned, and the impact that these diseases are having upon American society, especially upon African Americans.
Okay, well, and I want to go back to just visit just real briefly in 1998 and 1999, which is how STD-free began. At the health department, we recognized that our rates here in Nashville were higher than the national average. And so instead of the usual public health response, I think that Dr. Stephanie Bailey did some very brave things. She took some very decisive measures in that she already had around the city regional teams. And those regional teams at that time were addressing public health issues in specific parts of town. So the regional team in East Nashville began to look along with the clinic at the issue of syphilis in Nashville. And we decided to attack the issue a little bit differently from what you might expect from the health department. And so the response was, I think, a very smart one, and it's paid off for STD-free even to this day. So what happened was that we got together everybody that we could get together in Nashville, and we asked them to come to the Metro Health Department for a forum on the issue of syphilis. And now, Dr. Haney, most people don't want to talk about sexually transmitted diseases.
Very good.
They aren't interested particularly in HIV, and certainly syphilis, a curable STD, was not on the barometer of a lot of people. But I think that Bart Perky and Tina Lester and Dr. Bailey and several other of us that worked on the issue did a very good job in planning, and we were able to get individuals from politicians to people who work in youth service organizations to plain old laypersons who just had an interest in health in their community, media individuals, and most importantly, people from the faith community came out to that forum, and we were very happy with the numbers that came out. Now, what happened at the forum was that we had the data up on the walls, prominently displayed, and so that people could see not the issue just as a city issue, but down to the neighborhood level. And that was very important in galvanizing our community work groups, which out of that evolved Faith Work Group, which was headed up by Reverend Sanders, where we now are located inside the First Response Center, actually next door here to the studio. And Ms. Baldwin Tucker, Councilwoman Tucker now, with the Schools and Higher Education Action Group, and another action group was the Law Enforcement and Court Group, and then a couple more were Schools and Higher Education and Community and Social Services. There was also a group that worked with medical professionals. So altogether, those groups were able to effectively work with and educate those populations that we felt would make the best impact in terms of educating our community.
And then decreasing in numbers.
Absolutely, yes, sir. And so from those work groups, the STD-free organization evolved, and it evolved also into a coalition, which is what we have now. So there are 36 agencies that are part of the STD-free coalition. We meet on a monthly basis, the fourth Wednesday of every month, inside of the First Response Center at the Metro Center location. We have a meal that's free of cost to the coalition attendees and guests, and we talk about the issue of sexually transmitted diseases, but we also do something that's more important. We do collective planning in terms of activities and special thrusts that really meet the needs of the populations that we're trying to reach.
And so in a real sense, Ms. Whitlow, you've got a cross-section of the population in Nashville dealing with the whole issue of STD, but yet and still we don't hear that much about what's going on and now. But would you say that in what you're doing, do you think that you're successful in getting more information out in reference to it, or what the problem is?
I think that our community coalition has been very successful, and I think what points most strongly to that success is the decrease in numbers from epidemic proportions with regard to syphilis here in Nashville to less than 36 cases in just a small span of years. And that was with the help of the Metro Health Department and leadership at the clinic, and with a strong jail syphilis elimination program, but also, very importantly, those community coalitions and agencies that meet on a monthly basis and plan those activities.
And so what you started in 1998, 99, you've in reality continued, but you see fruition of some of that now.
Yes.
And what you're trying to do in a real sense is to keep people aware of the fact that, that unless we keep reminding folks of it, that we're going to get back into the situation that we were in
Absolutely.
in 1998. Now, do you think that we, well, in other words, we have a fairly good record in terms of STDs around the Middle Tennessee area? Would you say that? Is there?
I wouldn't go that far.
Okay,
I'd say that we have in Middle Tennessee and in Nashville, I think that we have come up with some innovative approaches. And particularly here in Nashville, we do well with the 3 C's, the community, the coalescing, and the collaboration, and those partnerships that really do impact disease in a meaningful way.
Very good. And of course, I think we've got a couple of minutes before the end of this segment. And let's see, before we move beyond that, is this the same coalition? Is this coalition also working on the issue of AIDS over the last couple of minutes that we have during this segment?
Yes, we provide about 6 products, so to speak, to the Nashville community. That's testing, which we provide OraSure testing, which is free of charge. We provide training, train the trainer, and something called the STD HIV update to the communities of Nashville. Anybody can take those courses. They're free of charge. We also provide education in terms of pamphlets and presentations, and we do a media awareness thrust. That involves going on shows like Comments, but also we have produced, well, not produced, but we have, with a partner, have access to 5 commercials that are 30-second spots. They run and have run on your networks, and they address Hispanics and African Americans, and there are figures in those commercials which are very high quality that are recognizable to those populations we want to reach.
And of course, Ms. Whitlow, let's take this final commercial break, and after which we'll come back and give you an opportunity to further enlighten us, as well as to perhaps give some information to our young people. And we'll be back following this very, very short commercial break. We're talking to Ms.